Welcome to the deep dive. Today, we're jumping into something pretty fascinating, a technology that's quietly changing in some really amazing ways. Medical imaging.
hmm
And specifically, we're zeroing in on MRI magnetic resonance imaging. You know, even if you've had an MRI recently, you might not grasp just how fast things are moving.
Oh, absolutely. The speed of change is,
Uh,
well, it's remarkable. Even just looking back maybe 5 years,
yeah,
the advancements in MRI are things we used to think were way off in the future.
right.
So our plan for this deep dive is pretty straightforward. Get you up to speed quickly on what's new, why it's a big deal, and we're pulling all this straight from the sources we've gathered.
Exactly. That's the mission for you listening in. We take this pile of info on MRI, pull out the really key stuff so you feel totally clued in on how this vital diagnostic tool is being, well, transformed. Okay, so let's maybe set the scene first. Thinking back, MRI scans used to be, let's be honest, slow. Really slow.
Yeah.
And noisy.
Noisy.
It felt like forever in there sometimes, but now we're hearing about high-res images in like half the time, sometimes less. What actually changed to make that happen?
Well, one of the first huge leaps was something called compressed sensing.
Compressed sensing.
Okay.
Yeah.
Yeah. Basically, it's a clever technique, mathematically clever, that lets us reconstruct really high-quality images using much, much less raw data than we used to need.
Less data. How does that work? Like taking fewer puzzle pieces but still seeing the whole picture.
That's actually a great analogy. It leverages the fact that MRI images have a certain structure. They're sparse in a way. So you don't need every single data point to figure out the final image accurately.
Huh.
And the impact is, well, it's huge. Scan times drop significantly. We're talking 50% faster, sometimes even more.
50%. Wow. So, okay, reconstructing from less data, faster scans. What does that actually mean for the patient sitting there?
Well, the immediate thing is obviously shorter scans, which is just more tolerable, right?
Yeah.
Think about kids or elderly patients or anyone who gets claustrophobic. Less time in the tube is a massive win. It can even mean less need for sedation sometimes.
That makes sense. Less sedation is always good.
Exactly. And, it also means the scanner is free sooner, higher throughput, more patients seen, shorter waiting lists, potentially. It ripples through the system.
Right. Okay. That's a big one. No. Let's shift gears a bit. The term you hear constantly, AI, artificial intelligence. We see AI-enhanced MRI popping up. Is this real AI, like, actually thinking? Or is it more just smart software?
Oh, it's very real. And yeah, it's genuinely transformative. We're talking about sophisticated machine learning algorithms, often deep learning, trained on absolutely massive data sets of images.
Okay.
And these algorithms are woven right into the workflow now. They help with cleaning up noise in the images, making reconstruction even faster and better. And this is the really interesting part, they can actually help detect abnormalities. Things like subtle tumors, tiny changes over time, stuff that can be really hard for the human eye to catch consistently, especially when a radiologist is looking at hundreds of scans.
So wait, is the AI making the diagnosis then? Is it replacing the radiologist?
No, not at all. That's a really important point. It's not about replacement. Think of it more like an incredibly powerful assistant.
Okay. Like an extra set of eyes.
Exactly. An extra set of highly trained, tireless eyes. It flags things, highlights areas of interest, quantifies changes. It helps the radiologist be faster and more accurate. They can focus their human expertise on the complex interpretation, the tricky cases.
Got it. So it boosts their capabilities, speeds things up, improves accuracy. That sounds incredibly useful.
It really is.
Yeah.
Especially with the sheer volume of imaging being done today.
Okay, moving from AI to something else that sounds kind of sci-fi. Whole body MRI. Is that a real thing people are getting now, like regularly?
It's definitely becoming more common, yes. Not quite like a yearly checkup for everyone yet, but it's finding its niche.
And what's that niche?
Primarily, its big uses are in things like early cancer detection, screening for people who have maybe a genetic predisposition, a higher risk for certain conditions.
Right.
And the newer MRI systems, they have better coils, better technology all around that lets them scan the entire body, head to toe, in under an hour now. With pretty amazing detail.
Under an hour for the whole body. That's impressive. And I guess it's important to remind ourselves, MRI doesn't use ionizing radiation, right? Unlike CT or X-ray.
That's a critical advantage, absolutely, especially if you're talking about screening or repeated scans over time. No radiation dose makes whole-body MRI a much safer proposition for that kind of thing.
Yeah, that seems key for screening. So we've got faster scans, AI assistance, whole body capabilities. Are we also getting like sharper pictures, better resolution?
Definitely. And that leads us to the cutting edge, ultra-high field MRI. Specifically, you hear about 7 Tesla systems, maybe even higher in pure research.
7 Tesla. Okay, I know standard hospital MRIs are maybe 1.5 or 3 Tesla. What does jumping to 7 Tesla actually give you?
So these 7T systems, you mostly find them in big research hospitals, clinical trials. They're powerhouses.
Right?
The main advantage is a much, much higher signal-to-noise ratio. And what that translates to, basically, is incredibly high resolution. Just mind-blowing image clarity.
Mind-blowing clarity, so you can see smaller things.
Exactly. Much smaller structures, tiny lesions that might be invisible at lower field strengths, and you get better contrast between different types of tissue.
Wow. Where is that making the biggest difference right now?
It's already having a huge impact
Yeah.
in areas like neuroscience, mapping brain structures and activity, and for diseases like multiple sclerosis, where seeing those tiny lesions is critical, especially for brain imaging. 7T is really pushing boundaries.
It makes you wonder what else we'll be able to see, what we'll learn when the resolution gets that good.
It really does. It opens up whole new questions when you can visualize things at that level of detail. Maybe understanding the brain, things like Alzheimer's, even consciousness. 7T could provide clues.
That's incredible to think about. So we've covered a lot, from those old, slow, loud machines just a few years ago to now having AI-powered whole body scans, ultra high-res imaging. It's a massive shift.
It really is.
So looking ahead then, given these huge leaps already, what's next? What does the future hold for MRI?
Well, the sources we looked at point to a few really exciting trends. One is even more personalized MRI protocols,
Personalize how?
tailored much more specifically to the individual patient, their condition, maybe even their genetics, rather than just a standard protocol. Another thing is integration with other health data, like from wearables.
Ah, connecting the scan to your daily health tracking.
Exactly, giving a more dynamic, holistic picture. But maybe the most disruptive development is portable MRI.
Portable, you mean like wheeling it around? Aren't these things usually massive, needing special rooms?
Traditionally, yes. But we're seeing real progress here. The sources specifically mentioned a system called Hyperfine. It's a low-field portable MRI, and it's already FDA approved.
Wow. FDA approved. So it's real, it's happening. What's the idea there? Like ER use.
That's one key area. Imagine rolling it up to a bedside in the ICU, or even potentially down the line in an ambulance or a remote clinic, for things like stroke detection, head injuries, where time is absolutely critical.
That would be revolutionary. Taking the MRI to the patient, especially outside major hospitals, rural areas, developing countries maybe.
Precisely. It's about accessibility, making this powerful diagnostic tool available where it wasn't before. That, I think, is described as the real game changer. Connecting this to the bigger picture, it democratizes access to advanced imaging.
It's incredible. This whole deep dive just highlights this profound shift, doesn't it? In just, what, 5, maybe 10 years, from a tool that was powerful but slow and maybe a bit niche to something becoming faster, smarter, more accessible. A real diagnostic powerhouse. So wrapping up, what does this rapid evolution really mean for you listening in and just for healthcare generally?
I think it means we're really just scratching the surface. The potential is enormous. The future of medical imaging looks incredibly bright, and honestly, we are just getting started.
It leaves you thinking, doesn't it? With this technology getting so much more powerful and so much more accessible, how is that going to reshape healthcare? Maybe in your own community or even globally over the next, say, 10 years.
Yeah.
What possibilities does that open up for catching diseases earlier, for preventing things, for getting cutting-edge care to more people? Possibilities we probably can't even fully imagine yet. Something to definitely keep an eye on.